Hi, this is Anissa. My project is physical therapy and strain counterstrain comparison for trigger points in the upper trapezius.
Is foam rolling more effective for reducing pain from trigger points than the use of the strain counterstrain massage technique in patients with a history of chronic trigger points in the upper trapezius?
I use CINAHL, Academic Search Premier, Sport Discuss, and Medline on the Norwich University Kreitzberg Library databases. I use the search terms upper trapezius and strain counterstrain. The article I found is called Effects of Conventional Physical Therapy with or Without Strain Counterstrain in Patients with Trigger Points of Upper Trapezius. The level of evidence is 1B because it was a randomized control trial. The sample size was 48 patients. No follow-up period was listed and there were no dropouts. This was somewhat useful for my PICO question because it addressed the effectiveness of strain counterstrain, but I was unable to find an article comparing this technique to foam rolling. The internal validity was strong because the patients included had trigger points within the upper trapezius and were randomly selected. The external validity was strong because it was a randomized control trial. The study compared strain counterstrain with PT and PT alone for effects of trigger points in the upper trapezius. Range of motion was measured with goniometry for all cervical range of motion. Comparisons were also made based on the visual analog scale for neck pain, working hours, and neck disability index. The study found that the p-value was 0.5, indicating significant difference between the comparison groups and indicating that strain counterstrain with PT could be more effective if used for patients with trigger points in the upper trapezius than PT alone. For strain counterstrain, the patient was seated with the affected shoulder in slight abduction. The neck flexed to the same side and rotated away from the affected side, as pictured. The conventional physical therapy was based on a plan from the Chartered Society of Physiotherapy, and it consisted of basic cervical range of motion. Strain counterstrain is commonly used for trigger points, so it is no surprise that it was more effective than PT alone. While this does not answer my PICO question, it gives me a baseline of the effectiveness of strain counterstrain for trigger point release in the upper trapezius. I would still like to find a comparison of strain counterstrain versus foam rolling. I would use strain counterstrain in clinical practice combined with physical therapy because I would want my patient to return to activity pain-free as soon as possible.